Welcome to the second part of Unit 2 in English for Career Nursing. Stay focused, listen carefully, and let's dive in. In this part, we have an exciting listening challenge for you. We'll go through a series of conversations, and your task is to match each one with the correct picture. Pay close attention, and don't be afraid to rewind if you need to hear something again. First, take a look at pages 4 and 5. The pictures you see are cropped and zoomed-in sections of a bigger scene. In each one, you'll notice two people, one asking for directions and the other giving them. Now here's your challenge. Can you figure out which picture goes with the first speaker? For question 2, try to recognize where the person is giving directions to. And for question 3, fill in the missing words. If you don't get it the first time, don't worry. Just listen again and check your answers. The more you practice, the better you get. All right, let's dive in, listen closely, and find the answers together. Let's go.
Unit 2. Listening 1. Directions 1.
Go out of here, and the door you want is just opposite. Go in through the door and give your prescription to the man behind the counter.
So it's just outside here?
Yes, just across the corridor.
2.
Go into the hospital through these swing doors, go along the corridor, take the first right, and it's the second door on your left.
Through the swing doors, down the corridor, first right, second left.
That's it.
Thanks.
3. Go along this corridor and turn left at the end. Go along the next corridor, take the second left, and go all the way along that corridor. The ward you want is right at the end, straight in front of you.
Thank you.
All right, let's go through the answers together. The first person we see is searching for a pharmacy because he needs to pick up his prescription. So the correct answer is A. You can notice that he is holding a prescription in his hand. In second scenario, we see two people, and one of them is saying, "Go inside the hospital." This indicates that they are currently outside of the hospital, so the answer is C. For the third scenario, the correct answer is B. Here, a lady is giving an address to the gentleman. Now, let's figure out which part of the hospital each person was looking for. Just pay attention to one thing before we start. To answer this part, you can't just rely on listening. You'll need to observe some details as well. For example, someone holding a prescription is typically heading to the pharmacy. For questions 2 and 3, please refer to pages 4 and 5 of your book. As you can see, the second person is on their way to the physiotherapy department. The third person is going to obstetrics. Just so you know, obstetrics is the area of medicine that focuses on childbirth and the care of women during the birthing process. Okay, let's fill in the blanks as we've practiced before. First, we'll read the questions together. Then we'll listen to the recording again to find the correct answers.
Unit 2. Listening 1. Directions 1.
Go out of here, and the door you want is just opposite. Go in through the door and give your prescription to the man behind the counter.
So it's just outside here?
Yes, just across the corridor.
2.
Go into the hospital through these swing doors, go along the corridor, take the first right, and it's the second door on your left.
Through the swing doors, down the corridor, first right, second left.
That's it.
Thanks.
3. Go along this corridor and turn left at the end. Go along the next corridor, take the second left, and go all the way along that corridor. The ward you want is right at the end, straight in front of you.
Thank you.
All right, I hope you were able to find the answers. But if you couldn't, no worries. Just listen to the conversation again. Now, let's review the answers together now. 1. Go out of here and the door you want is just opposite. 2. So it's just outside here. 3. Go into the hospital through these swing doors. 4. Take the first right and it's the second door on your left. 5. Take second left and go all the way along that corridor. To become more familiar with the phrases used into the listening, let's talk about some of them. The phrase "go all the way along that corridor" means to walk or proceed all the way to the end of the corridor. It's a common way to give directions. This means you should keep going straight without making any turns until you reach the very end of the corridor. The swing door is a door that can be opened in either direction and is closed by a spring device when released. Now the book instructs you to work in pairs. First, take a minute to study the picture on pages 4 and 5. After that, student B should close the book. Then, student A will ask for directions starting from the reception area, and student B will try to give those directions from memory. Here's an example of how it might go. Student A asks, "How do you get from physiotherapy to surgery?" Student B responds, "You go along the corridor and..." This exercise helps you practice giving and understanding directions in English, so give it your best shot. Don't forget, the key to improving your language skills is practice, and then practicing some more. Without regular practice, progress can be slow. So don't hesitate to find a partner to practice with as much as you need. If you want, you can even ask for a nurse partner like yourself in the comment section. Learning together is much more enjoyable. And remember, the more you practice, the better you'll get. So keep at it and enjoy the learning journey. Okay, now let's learn how to give directions when we are writing an email. In this exercise, you will use the map to complete the blanks in an email. Imagine this scenario. Alicia needs to direct Mr. Keene from the railway station to the hospital and specifically to the renal unit. We are going to help fill in the blanks in her email to provide clear directions. Pay attention to how we use landmarks, turns, and street names to make the directions as helpful as possible. This practice will not only improve your writing skills, but also your ability to give and follow directions in English. Dear Mr. Keene, here are the directions you asked for from the railway station to the City Hospital renal unit. Leave the railway station at the main entrance. Turn right and walk along Station Street for about 100 meters. Go across the road to the number 45 bus stop. Take the bus to the hospital. Get off the bus opposite the hospital. Walk along Byron Avenue and take the first left. The door to the renal unit is on your right. The renal unit is next to the Hospital Research Library. Regard. Now for a practical exercise, let's write an email giving directions to a friend on how to get to where you work or study from the bus or railway station. This is a great way to practice your English writing skills and learn how to communicate clear directions effectively. Start your email with a friendly greeting, then describe the route step by step. Mention any important landmarks, turns, or street names that will help your friend find the way easily. End your email with a warm closing. For example, you might start with "Dear friend's name," then proceed with, "Once you arrive at the station name, here's how you can easily find your work or school." Remember to keep your directions clear and concise. Before we dive into the It's My Job segment featuring William O'Neill, who works as a porter in a hospital, let's do a brainstorming session. Think about what tasks a porter might be responsible for in a hospital setting. Porters play a crucial role in hospitals by assisting with various tasks. They might transport patients between different departments, deliver medical equipment and supplies throughout the facility, and ensure that items like linens and medical instruments are available where needed. They also help maintain cleanliness and order by moving beds and other furniture as required. Take a moment to consider all these responsibilities and maybe jot down a few ideas. What else do you think a hospital porter does during their day-to-day work? This activity will help us better understand and appreciate William's role when we read about his job. Before we delve into William's job description, let's first familiarize ourselves with some important terms that are frequently used in a hospital setting. Understanding these terms will make it easier to comprehend what William's responsibilities might involve. First, we have mortuary. A mortuary is a building or room within a hospital where dead bodies are kept before they are buried or cremated. It's important in managing post-mortem care. Next is stretcher. This is a type of bed specifically designed for transporting patients. It allows for the safe and efficient movement of patients who are unable to walk or need to remain lying down. Then we have specimen. This refers to a small part or sample taken from something, like body tissues or fluids, to be tested in a lab. This helps in diagnosing diseases. Lastly, sample is a term similar to specimen. It refers to a small amount of something, like blood or urine, taken to be analyzed as part of medical tests. Understanding these terms will give us a clearer picture of the hospital environment and what William's day-to-day activities as a porter might include. As part of our usual routine, let's start by reading the questions first. This helps us understand what information we need to look for. Then we'll move on to reading the text itself. This approach ensures that we're focused and know exactly what details to pay attention to as we go through the material. It's a great strategy to enhance comprehension and efficiency in reading. 1. Porters only push food trolleys around. 2. They move patients around the hospital. 3. Porters take dead patients from the wards. 4. Each ward makes 4.5 kilos of waste a day. 5. The porters destroy all the waste. 6. Porters give the patients their mail. Now let's move on to reading the text itself. William O'Neill. I'm the head porter in this hospital. What do I do? Well, I run the place. Porters do more than just push food trolleys around the hospital. We transport patients by wheelchair or stretcher from the wards to radiology or physiotherapy and back again. We remove dead bodies to the mortuary. We lift and carry heavy equipment and furniture, and we dispose of all the waste. Each hospital bed produces 4.5 kilos of waste every day. We collect it each day and take it away for recycling. We deliver the post all over the hospital and bring letters for patients. That's a very important thing. As we move around the place, we take files, samples, and specimens from here to there and back again. Last year, I walked 1,800 kilometers. To do all these things, a porter must be fit, be able to think clearly in an emergency, and be polite and friendly. Next time you are waiting for a porter to answer your call, please be patient. He will be with you as soon as he can. Before we start answering the questions, let's take a moment to discuss the routines and job descriptions within the hospital, especially focusing on the role of a porter. It's important to note that a porter's job description can vary from one hospital to another. For instance, in many hospitals across North America, pushing food trolleys is typically part of the food service department's responsibilities, not the porter's. Similarly, the task of disposing of waste often falls under the duties of the cleaning and service management team. Understanding these differences helps us appreciate the specific roles and responsibilities assigned to various staff members within a hospital. Based on what we've read, let's go through these true or false questions together. First, the statement that porters only push food trolleys around is false. As we discussed, the role of a porter involves much more than just handling food trolleys. Second, it's true that porters move patients around the hospital. They are essential in ensuring patients get to where they need to go for treatments and tests. Third, porters take dead patients from the wards is also true. This task is part of their responsibilities in many hospitals. Next, the claim that each ward makes 4.5 kilos of waste a day is false. The actual amount can vary significantly depending on the size and type of the ward. The porters destroy all the waste is false. Disposing of waste is generally handled by the cleaning and service management teams. Lastly, it's true that porters give the patients their mail. This is one of the many duties they perform to help maintain the daily operations of a hospital. Let's fill in the blanks with verbs that fit the context of William O'Neill's job as a porter in the hospital, based on the common tasks typically performed by porters. 1. We transport patients by wheelchair or stretcher. 2. We lift and carry heavy equipment. 3. And we dispose of all the waste. 4. We collect it each day and take it away for recycling. 5. Each hospital bed produces 4.5 kilos of waste every day. 6. We deliver the post and bring letters for patients. Let's look at the meanings of these important words, which are frequently used in various contexts, including healthcare. 1. Transport. This verb means to carry or move people or goods from one place to another. In a hospital, it often refers to moving patients between different departments or areas, using wheelchairs, stretchers, or beds. 2. Dispose of something. This phrase means to get rid of something, usually by throwing it away or recycling it. In a hospital setting, disposing of might refer to handling medical waste, used supplies, or other materials that need to be carefully managed to maintain hygiene and safety. 3. Produced. This verb is used to describe the act of creating, making, or generating something. In the context of the statement from the exercise, it refers to the amount of waste generated by each hospital bed, emphasizing the output or result of a process. 4. Deliver. This verb means to take goods, letters, packages, or other items to the people they have been sent to. In a hospital, porters might deliver mail, medications, or even meals directly to patients. Great job! Let's take a short break, and when you're ready, we'll move on to part 3 to keep learning together.